Right now, as you read this, an AI system built inside Google is still scraping hospital records that were never supposed to leave the building, and the U.S. Department of Health and Human Services can't stop it. 10 million patient files, full names, diagnoses, lab results, prescriptions, moving through Google's servers without a single patient's consent. Not blocked, not shut down, just renamed, folded into a quieter division, and left running. Tonight, we're exposing the internal project Google hoped you'd never learn the name of. In 2019, Google partnered with Ascension, one of the largest hospital chains in America, on something called Project Nightingale. Officially, it was framed as infrastructure, cloud storage, better data organization, tools to help doctors work faster. Google said it was standard business, the kind of vendor arrangement hospitals sign every year. No wrongdoing, they insisted, just modernization. That's the story that made it into the press releases. That's the story Google wanted to end there. But internal documents obtained by the Wall Street Journal told a different one. And once the reporting started, something changed inside Google. Doctors weren't briefed, patients weren't told, and an AI layer quietly was already active underneath it all. That AI layer wasn't just storing files, it was analyzing them. Machine learning models trained on real patient histories, generating individual treatment recommendations, flagging patients for follow-up care, scoring risk levels behind the scenes. No patient signed anything. No doctor requested a second opinion from a machine. Google employees who raised concerns internally were told to stop discussing it, even with each other. Some described a climate of enforced silence, not a formal gag order on paper, but pressure close enough to one that people complied anyway. A whistleblower leaked internal files anonymously because there was no official channel that would listen. And it's still running. Under a different name, inside a different division, the underlying architecture never actually stopped. The Department of Health and Human Services opened an official inquiry through its Office for Civil Rights. On paper, that sounds like the end of it. A federal agency, real subpoena power, a mandate to protect patient privacy under HIPAA. Reporters called it a reckoning. Google faced congressional questions, executives testified, and then quietly the inquiry closed without a single enforcement action. No fine, no injunction, no forced deletion of the data already collected. And here's the part nobody reported. The regulator already knew this was legal before it opened the inquiry. HIPAA has a provision called a business associate agreement. Under that provision, a company processing health data on behalf of a hospital doesn't need separate patient consent. The hospital's original consent form covers it, even for a partner the patient has never heard of, never agreed to, and will never be told about by name. HHS wasn't investigating whether Google broke the law. It was investigating whether the law even applied. And the law, as written, was built decades before AI existed to analyze this data at scale. That's the mechanism, not a hack, not a breach. A loophole so old it predates the technology exploiting it, and so entrenched that closing it would require rewriting federal healthcare law itself. Google didn't need to hide Project Nightingale from regulators. It only needed to survive the news cycle. Once the headlines faded, the infrastructure kept operating exactly as designed, because nothing about it was ever technically illegal. Remember that AI diagnostic layer scraping 10 million files without consent? It didn't disappear when Google Health was dissolved in 2021. The tools were absorbed into Google Cloud's healthcare division, rebranded, redistributed to new hospital partners under new contract names. Different letterhead, same architecture, same loophole, and it's still running. If you've had a hospital visit, a lab test, a prescription filled through a health system that uses any Google Cloud healthcare product, some version of your data has likely passed through a system built on this exact framework. You were never asked. You were never told which company touched your chart, whether an algorithm scored your risk level, or what that score was used for. There's no dashboard where you can check. There's no opt-out button. Consent you gave was to your hospital, decades-old paperwork written before any of this technology existed, and it's being used today to cover analysis nobody explained to you. So who actually benefits from a law this outdated staying exactly as it is? Not the patients who never knew their charts were being read by a machine. Not the doctors who found out from a newspaper instead of their own employer. HHS had the authority to close this loophole after Project Nightingale. It chose not to. Google had the ability to ask for consent. It chose not to. The system that started this story is still active tonight, inside a hospital near you, under a name you've never heard, and no one in a position to stop it has explained why they haven't.